Welcome to Getting Results with Laser Acupuncture. I'm Dr. Adrian Larson. I'm an acupuncturist and chiropractor. I've been doing laser acupuncture for about 12 years and really love the results. Patients really love it. I'm excited to tell you more about it. Now, I'm assuming you're here because you're a practitioner, that perhaps you're interested in doing laser acupuncture yourself or learning more about it. Or maybe you're a patient and you're interested in learning a little bit more about what your practitioner might be doing. Either way, we've got some great information, so here we go. Let's start by talking about what laser acupuncture is. Well, it's a safe, effective, and painless method of performing acupuncture without the need to pierce the skin with needles. So you get acupuncture-like results and acupuncture effects without the downside of the potential problems that come with using needles. Laser acupuncture is gaining acceptance all over the world. You see, it's quite common in Europe, parts of Asia. It's catching on. It's becoming more common in the United States as well. And it's certainly becoming much more well known throughout the world. Now, it's often applied in situations where needles might be inappropriate or undesirable. There's your classic needle-phobic patient. Somebody who's heard about the good effects of acupuncture and they'd really like to try it, but they just can't get past the idea of having needles. And part of that comes from our Western use of needles, where most patients come to us, their typical experience with needles was getting a vaccination or donating blood where the needle's the size of a straw. They don't really understand that needle acupuncture can be very painless and very comfortable, and they're too scared to try it. This is where laser is your best friend. You can also use laser acupuncture in areas where you don't want to use a needle. For example, a sensitive location, or with infants, children, elderly people. There's no real reason that you can't substitute laser for needle in just about any location and any situation. Let's talk a little bit then about the history of how laser acupuncture started and where it developed. So, experiments in laser healthcare began almost as soon as lasers became commonly available. First lasers were developed in the 1950s. Availability outside the lab started in the 1960s, and people almost immediately began experimenting. What can we do with this new kind of light, this coherent light that had never before been experimented with in healthcare? And so early experiments focused on laser's effects on the skin, where the light's going to touch. Found that laser stimulation could benefit wound healing. You could increase the speed with which wounds would heal. You could minimize scarring. Those were some of the first effects that were found, and it was really exciting that by using coherent light, you could actually change the way the body reacted. The field now is broadly known as photobiology, and that field really studies the effect of light on all facets of the organism. You can look at it at the cellular level, how the cell's organelles are affected by light. And then you can look at it at more of the whole organism level, how different types of light affect the organism as a whole. You can look at how light affects the eye, how it affects the brain. Of course, we tend to look at how it affects the acupuncture meridians. But all of that is really a fascinating and wonderful field. It's still growing rapidly, and there's lots of good studies going on. The biological effects of light. Now, current research shows that laser stimulation helps a number of items. Regeneration of cells and healing that we talked about, decreasing pain and reducing inflammation and injuries, improving circulation, and even laser stimulation of hair growth. Now, these are all what we call low-level lasers, meaning that they don't produce heat. These aren't the same lasers you see in laser surgery, where they're actually using the laser like a scalpel to burn or to cut. But we're talking about low-level lasers where we're only using the light energy as a way to stimulate a specific effect without actually producing any heat. Now, the history of lasers in acupuncture really kind of started back in the 1970s when the first acupuncture research with lasers began to be published. And there was a lot in Russia and in the USA, kind of simultaneously going on in the 1970s. By the 1980s, due to numerous positive reports, laser started to be recognized as a safe method of stimulating acupuncture points and an effective method without having to use needles. So the real question is, how does it work? How does merely shining light, a special kind of light, granted, but shining light on an acupuncture point, how does it actually affect the body and do what it does? Well, there's evidence that laser light penetrates the skin and deposits energy into the cells. There's lots of photobiology studies that show that, and you have cellular effects. But in acupuncture, we're talking about laser energy entering the acupuncture meridian system and being conducted through the meridians. Now, the meridians are these lines, these conceptual lines of energy flow that have been developed and used in Chinese medicine over the course of thousands of years, and used quite successfully for all kinds of health issues. And we find that using a needle to stimulate energy movement in those meridians is effective. Using a laser also seems to stimulate the energy movement in those meridians. Some interesting studies have been done. A 1991 study in particular carried out at the Institute for Clinical and Experimental Medicine in Novosibirsk, Russia. There they did a study where they shined laser light on various parts of the body, and they found that the light penetrated more deeply at areas where we would have a traditional acupuncture point identified on acupuncture charts. It was also found that that light actually traveled under the skin to other acupuncture points, but it didn't travel to places that weren't on acupuncture meridians. So what it appears to be is, for want of a better way to explain it, it's kind of a fiber optic network, where when laser light enters an acupuncture point, it travels through the meridian and can be detected at other parts of the body with a sensitive photon detector. So, fascinating study that shows that the light actually is received and used and transmitted throughout the body. Recent studies using advanced brain imaging, as well as a lot of other advanced protocols for measuring various physiological effects, the bottom line, they show that laser acupuncture on the body has measurable effects, not only locally on the body, but also in the brain, similar to needle acupuncture. So you can use a laser on the toe, for example, and see measurable effects in the brain. And even when you do a double-blind study where you use a laser that's not activated versus a laser that is activated, you find out that if the laser is off, you don't get the effect. If the laser is turned on, you do get the effect. So clearly something is happening. And obviously there's a lot more science to do. There's a lot more study going on about the mechanisms, why this works so well and how it works. But the great news is there's a lot of evidence that it does work. Successful published studies have shown good effects of laser acupuncture for all of these items: hiccups, bedwetting, weight loss, postoperative nausea and vomiting, pain control, anesthesia for surgery, surgical and dental anesthesia, carpal tunnel syndrome, dry eyes, stroke-related paralysis. These are some of them. There are more, and there are studies continually going on all the time. But it's very similar to the types of results that you would see with normal needle acupuncture. Some of the advantages, however, to using a laser in acupuncture include, first of all, safety. There's no skin heating with a laser, and there's no skin penetration. This means that there's zero risk of infection, zero risk of cross-contamination, bloodborne pathogens, any of those things that we need to worry about. And there's also no risk of puncturing something with a needle that you shouldn't puncture. Particularly on the chest, for example, puncturing a lung and creating a pneumothorax. Can't happen with a laser. So a great deal of safety. Next advantage, it is completely painless. The patient feels nothing at all. Now I want to put a little asterisk there though, because occasionally I've had a patient who will feel something, but it's not something that they can quantify or describe very well. An energetic feeling perhaps. They'll say, wow, when you turn on that laser on my hand, I can feel it go all the way up my arm. Maybe it's something that certain people are more sensitive to and can perceive. Maybe it's something that they generate in their own mind. I don't know. But occasionally you run across a patient that feels it. And they describe it as a gentle, pleasant kind of a sensation. For the most part, though, nobody feels anything at all. Light doesn't really tend to stimulate any kind of a feeling in the body. Laser acupuncture is easy. Simply put, you light up the point with the laser. You do it for a number of seconds, depending on the power and the output of your laser, and then you move on. It couldn't be any simpler. And it is fast. It doesn't take a whole lot of time to do that. We're talking seconds, whereas with needle stimulation, sometimes needles are retained for 20, 30, 40 minutes, even more in some cases. And laser acupuncture is effective, often shown to be as effective as needle acupuncture for a variety of problems. So this is good. You know, something else that I didn't list here, there are a number of practitioners who are actually training their patients to treat themselves with lasers, giving them lists of points, instructing them how to obtain a proper laser, or helping them obtain a proper laser. And so for in-between visits, this is something that patients can do to maintain their own health. And it's safe. There's no danger or risk to having a patient do that. So that's another advantage to consider. So how to perform laser acupuncture? Well, first of all, you've got to locate the point. And you would locate that based on the principles of traditional Chinese medicine. Whatever diagnostic procedures you're using to determine what points need to be treated, well, those would apply equally. You just do the same thing you would always do. Choose the points. Those points can be anywhere on the body except near the eyes. Now, laser light, because it is monochromatic, meaning it's all one color, there's only one wavelength, and it's coherent, meaning that the waves of the light are all in sync with one another, it is very powerful sort of light. And so you don't want that entering the eyes. Obviously, the tissue of the retina is very light sensitive, and putting light this concentrated and this powerful on the retina can be dangerous and damaging depending on the power of your laser. There are lasers out there that in literally 1/1000th of a second will destroy the retina cells they touch, or not touch, but the light shines into. Those kinds of lasers are not used in acupuncture, obviously. But you want to make sure you're never doing acupuncture around the eyes, because you don't want to accidentally shine a laser in a patient's eye. That's the only contraindication that you really need to be conscious of. Other than that, you can use any part of the body. Even if you have a wound or an injury, you can shine laser light on that area, and there's no danger of infection because you're not actually going to touch the skin. Generally, you're going to laser for approximately 15 to 60 seconds, depending on the power and the type of the laser that you're using. But you can have good acupuncture effects in as few as 10 to 15 seconds with most lasers. Sometimes you'll want to go longer for specific reasons, depending on what you're trying to do. And again, I want to put in a reminder, never stare directly at the beam, and frankly, the dot that's on the skin, it's not a good idea to stare at that either. If the skin is intact and there's no danger of infection, it's a good idea to have the tip of your laser actually touching the skin, because that minimizes light scatter and light reflection. And therefore, there's less danger of somebody, getting a reflected beam into their eye, and that would be uncomfortable. Now, some safety considerations. As always, with any medical procedure, we want to make sure that safety comes first. So, I'm going to reiterate, remember the eyes and remember reflected light. You may want to use a pair of laser safety glasses like those shown here. Now, depending on the type of laser, a lot of the lasers used in acupuncture don't need the glasses because they're of a classification. Class 3A, for example, is considered eye safe because the blink reflex is fast enough to prevent any damage to the retina. However, there are some class 4 lasers out there that I've seen used in acupuncture. That's really a high-powered laser, and for those, the glasses are required. So you need to know your equipment. Make sure that you have the proper safety equipment to go with it. Second, due to the fact that laser has been shown to stimulate cell growth and repair and to increase the speed at which cells can grow, it's not a good idea to use it where you don't want cell growth. So you wouldn't want to laser somebody's skin cancer, for example. Just be aware of that. When you're treating acupuncture points, you don't want to be near anything that shouldn't be growing. Otherwise, laser is harmless. You can't overdose, you can't cause negative effects, and if you laser the wrong acupuncture point, what will happen to the patient? Absolutely nothing. So let's talk a little bit about laser equipment. It's important that you understand the equipment that you're using so that you can get the best effect. You can spend whatever you want on laser acupuncture equipment. There are lasers out there for under $100 that do a fine job. There are lasers out there for over $10,000 that also do a fine job. It really is up to you. But I'll tell you, what really matters on a laser is the output. The light that it produces is what does the job. And you'll find that across the broad spectrum of prices, the output is often the same. You can find a laser for a very low cost that might have the very same output as a very expensive laser. So output is what you need to understand, and you need to learn. We're going to talk a little bit more about how to understand laser output. And you need to consider your needs and uses. Are you using your laser only for acupuncture? If so, it really only needs to do one thing, and that is produce the correct and appropriate laser beam. If you're using it for other things, like, for example, treating musculoskeletal pain and inflammation, and you want to be able to sweep a broad area, then you'll need a different kind of laser that has that capability. So, think about what you're going to use a laser for. I'm going to kind of confine today's talk to acupuncture uses only. And last but not least, you need to know what you're buying. You need to understand the specifications of a laser so that you're going to get the right laser for the job. So first thing we need to understand is the wavelength. The wavelength refers to the color of the laser. So as you can see in the chart here, as you go from about 400 on the low end down in the violet spectrum on up to about 800 on the high end in the infrared spectrum, you go through the entire range of visible light and all the colors. Common laser acupuncture wavelengths are up in the red spectrum. You see some green ones out there. You see some blue and some ultraviolet as well. And a lot of that is really actually driven by what lasers are produced. Producing laser light is a very specific process, very specialized, because it's a special kind of light. And you can't just get it in any color you want. There are certain processes that produce certain wavelengths, but there are other wavelengths that lasers are simply not available. And so a lot of what's driven the development of laser acupuncture has been what colors are out there and what do they do? Rather than saying, well, I need something in yellow, give me a yellow laser. Sorry, there isn't one. Different wavelengths do have different applications though, and we'll discuss that a little bit coming up. Now, power of a laser is measured in milliwatts generally. Believe me, you don't want a laser that's measured in watts unless you're planning to blast holes in things. But milliwatts tells you how much power output, how bright that light is, how concentrated it is. Generally for acupuncture, you see a lot of 5 milliwatt lasers. Those are class 3A lasers according to the FDA. That's the most common. That is eye safe. It's a low power output, but it seems to do a very nice job for acupuncture. Now, this is not a deep penetrating laser where you're going to get down into muscles and you're going to deal with inflammation and injuries and things like that. That's a different philosophy. I kind of talk about, there's two ways to communicate. You can shout or you can whisper. Both can be very effective ways of communicating, and both have their place. The high-powered, the class 4 lasers, these deep infrared lasers that really penetrate deeply, that's kind of the shouting, and that has certain functions and ways you'd want to use it. The 5 milliwatt laser is more of the whispering, but because you're dealing with the power of the meridian system, all it needs is a little push, a little whisper to do what needs to be done. You're working with the body, with the energy system of the body to get the job done, so it doesn't take a sledgehammer to do it. So I'm a proponent of the lower powered lasers. Now, in the different wavelengths, 635 nanometer red, it's kind of a bright red, that's the most common that you see. There's also a red out there that's the 650 to 670 nanometer. Now those are your laser pointers that you go buy at the office supply store that are used in presentations. The 650 to 670 is not a particularly powerful or deep penetrating wavelength and does not seem to have the same biological effects. The 635 is actually the wavelength of the light that's produced inside the cells of the body. So it is biologically compatible with the body. Now the 635 has what we'd call a stimulatory effect. Studies have shown that it increases ATP production in the cell, improves cell growth, wound healing, we talked about that. In acupuncture, we would call that a tonifying effect. So if you want to have a tonifying effect on a meridian or a point, 635 is a good choice. Or just general stimulation of a point. 635 is an excellent choice for that. Let's talk about blue now. New on the market, there's a 450 nanometer laser. That's a blue laser. And it's just recently become available. And that's a true blue. It's not the previous so-called blue that was really a violet or an ultraviolet color. That's the 405 nanometer. But the 450 is a pure sapphire blue. And blue light tends to have a calming or an inhibitory effect. In fact, I just read a study where they were putting in blue lights in Tokyo subway stations because suicides were becoming very common. People would throw themselves in front of the trains, and they thought that the blue lights would help calm people down, have a sedative effect, and they're hoping that just changing the color of the light is going to reduce their suicides, and I hope it does. In acupuncture, you would call this a sedation effect. So if you wanted to sedate an acupuncture meridian or an acupuncture point, blue light would be an excellent choice for that. So if you have red to stimulate and tonify and you have blue to sedate, you have a pretty good tool set for acupuncture right there. Now, there are also lasers out there in the 800 to 1000 nanometer range. These are infrared lasers. And infrared lasers are deeper penetrating. It's not a visible beam at all. You can't see the beam. And generally these produce some heat, and their purpose is to produce some heat. So when you have wound healing or deep injuries where you want deep tissue heating, then these lasers are often used. Not necessarily the choice that you want for acupuncture, although there have been a number of studies of these infrared lasers used on acupuncture points, and they do get great results. But they seem to do that using kind of the more of the shouting mechanism, the high power mechanism. And these lasers generally are more powerful and more expensive. So they'll certainly get the job done, and if that's the laser you want to use, that's great. My recommendation, I like to stick with the 635 visibles. Deeper penetration and heating effects out of the infrared, which we just talked about. And then there's also green lasers on the market, 532 nanometer. Now, I see some of these being sold and promoted, but the truth is green has a very poor penetration profile for getting into the skin. And there's really not been studies and evidence produced using green lasers for very much at all. Most of the studies have been done on the reds, the infrareds, the more common wavelengths. And so if you're thinking about using green as your primary acupuncture laser, I wouldn't recommend it just because there's really not much data that shows effectiveness, and there's just the physics profile shows that the penetration is rather poor. So if you wanted to have a green one as an alternate laser, maybe to experiment with, see how it does, that's a great idea, but I wouldn't recommend it as a primary laser for acupuncture. And so to summarize what we've talked about in this brief presentation, laser acupuncture. It's safe, effective, comfortable. Patients really seem to like it. They like the idea that they're using a high-tech, modern form of acupuncture, and they like the idea that they're not getting needles. Lots of studies out there show that it's effective, very easy to perform for the practitioner, and very fast to perform, which is a real benefit, being able to get a job done in seconds that would normally take a half hour. Make sure you get the right equipment. You're going to want to understand the wavelength, understand the power output, and understand the use that you're going to have for the equipment. And as always, you want to remember safety first. Watch out for the eyes. Make sure that you're careful about reflected light. Use laser safety glasses if your type of laser requires them. If you'd like more information, please contact us at Meridia Acupuncture Technology. We're available at www.acugraph.com or 208-846-8448. We have experienced acupuncturists that know a lot about the technology who would love to take your questions and love to help make sure that you get all the right equipment that you need for your practice. Thanks again for attending this webinar. Appreciate it. Hope it's been useful to you. I'm Dr. Adrian Larson, and I will see you next time.